I think it's a good idea if every child under consideration for the surgery can have some type of comprehensive health assessment. This may be done completely by one provider, or it may take a village of providers to come in and all work together to make it happen. But within that assessment, you really want to use all the information within that to get a sense of how healthy the child is and what their health trajectory perioperatively is going to be like, and to identify any risks or any health issues that you feel like you have to address ahead of the surgery to optimize the health of the child. So a few things that we consider going through that. One, reviewing all the child's chronic health conditions, thinking about how controlled they are, how not so well controlled they might be, how severe they are, how they could affect anesthesia, how they could affect postoperative recovery, going through line by line and thinking about those. And maybe you get the specialists who are involved in a particular problem, who's really the expert in that, to help you understand how to assess those. We also try to go through and review all the medications. You know, you've got this very stressful time of in the operating room and even afterwards where the children may not be able to, they're not in a state of being able to take things intrally where they would for their usual medication route. So you have to convert some medications to intravenous form. That can be tricky sometimes with seizure medications and other things, but you want to have plans for how to do that and manage the children's medications. The third are all the technologies that a lot of these children are living with to optimize their health and functioning at baseline. Children that have cerebrospinal fluid ventricular shunts for hydrocephalus, or baclofen pumps, G-tubes, trachs, pacemakers, insulin pumps. I mean, there's so many things out there. You want to make sure that all those things are working properly, and that they're not going to interfere with the spinal fusion surgery. And you want to troubleshoot what could potentially happen with them afterwards and make contingency plans for what to do if problems should arise. In addition to that, nutrition and hydration is such a big deal. And I've been surprised at the number of times where we review nutrition for children under consideration for surgery to learn that they're not as nourished as they could be, or their water intake and hydration isn't quite sufficient. And you know, that's a type of problem that if you want to try to address takes time, and you can't really overcome something like that a few weeks ahead of surgery. It may take months in order to figure out what formula changes might need to be made, or caloric intake, or other things to optimize fat stores, and nutrition for a child to optimize wound healing, and everything perioperatively. In that same space, and Dr. Emmons can speak to this as well, is thinking about the bone health of the children. You know, I mean, you're operating on the spine, you're talking about, in many cases, instrumentation, hardware going into the spine that you want to adhere there and to stick. And for many children with neuromuscular conditions, their bone health and their bones are very fragile. And we don't have a lot of evidence on how to optimize bone health for the kids going in, but figuring out how to assess that and to treat that if needed with vitamin D and bisphosphonates and all these other treatment options that are there with endocrinology is a big deal, and again can take a lot of time. It's not like you can sort of take a child with fragile bones and make them strong a week ahead of the surgery. It may take 6 months or a year to do that, or it may not even be possible to optimize the bone health.
I was really wanted to have face-to-face encounters with all of the specialists that he was being followed by, just to, because I feel like they'd have their eyes on well, potentially they would see something that we weren't thinking about. So it was a long year of having multiple appointments, and to really weigh through. I'm glad we did it. I felt much more confident going into the process.